Well, Sick Kids Hospital says it's monitoring 7 probable cases of severe acute hepatitis that have been reported in other countries in recent months. CP24's Courtney Hills is live outside Sick Kids Forest this morning. Joins us now with some more details here. Courtney.
Good morning, Nick. That's right. And Sick Kids Hospital says the probable cases were diagnosed between early October and late April. The hospital has been in touch with Public Health Ontario to make them aware of what they're seeing at this time. We know physicians around the world are watching this illness very, very closely, partly because there are still so many questions surrounding it. Now, to talk more about it, I want to bring in Dr. Dina Kulik. She's a pediatrician, also the founder of Kid Crew. Good morning, Dr. Kulik. We appreciate your time. I was talking about the questions surrounding this severe acute hepatitis. Why is it so challenging to identify what might be behind the cause of this?
Good morning. Usually we find hepatitis viruses or other viruses in the blood when we test for hepatitis in children. The challenge with this, breakout of new cases, I would say, is that the typical hepatitis viruses are not being found in these children. Some kids have tested positive for COVID. Some had previous infections with COVID that were documented, and many kids are testing positive for a typically benign virus called adenovirus, which doesn't typically cause hepatitis or really severe illness at all.
And will it be helpful, the fact that we are seeing these cases pop up around the world now, but we also know at the same time physicians, medical experts are getting involved, so seems like this global effort to find those answers at this time?
Correct. I mean, there's been kids documented with hepatitis around the world, many countries now, and we are all, as a global community, on the lookout for these children to help, obviously, intervene sooner to prevent them from getting very sick, or intervene with things like liver transplant if we need to, and also to hopefully figure out what might be the cause so we could prevent further cases.
We know in some cases it can be quite serious, but we're also hearing it is rare. How rare is it, especially this form, this acute hepatitis?
We don't see it that often. Now there's been about 230, 240 cases documented worldwide, which is a lot for one particular illness in a short period of time. But still, we're talking about less than 250 cases in the whole world. So I don't want people to panic. It is something we're looking into. It'd be great to figure out a cause so we can intervene sooner, but I don't want people to be panicking quite yet.
Talking about signs and symptoms, we heard through Sick Kids Hospital, they've been monitoring, so watching for any possible symptoms of this illness. And I know that's also the message for many physicians across this province. What would you tell any parents who are concerned, who are curious what to watch for?
So most typically with hepatitis, we see kids having belly pain, having vomiting, having diarrhea. That being said, there's a lot of stomach flu going around. There's a lot of COVID going around with the same symptoms. In particular with hepatitis, it's inflammation of the liver, causes liver disease, liver failure. Kids will get jaundice, so they will have yellow tinge to their skin and to their eyes. If your child is unwell in any way with any of these symptoms, particularly with jaundice, I do very much recommend touching base with your healthcare provider. We can order simple blood work, and that can show us if the liver enzymes are elevated. That is what shows us if a child has hepatitis.
All right, Dr. Kulik, thank you for your time this morning and for sharing your take on all of this. We really appreciate it.
You're welcome.
So, Nick, we